Western Spring Television. Ours it is.
Ladies and gentlemen, welcome to a world where warmth and connection flow abundantly. Join us as we embark on a journey of healing and discovery, brought to you live from the prestigious Western Spring Television studios. Prepare to be embraced by a wave of positive energy and insightful discussions. Thank you for tuning in and being a part of our community. I am Temitope Ajijola. Our Spring Clinic will delve into everything health and well-being so we can help you not only to feel better, but also bring you information that will help you reduce the risk of diseases, lengthen your lifespan, save you money, and benefit the environment. For some time now, we have been discussing basic anatomy, examining the human body organs and systems via the respiratory system, the digestive system, the circulatory system, the excretory system, the nervous system, the reproductive system. We've had the honor of our own medic, seasoned family physician with over a decade's worth of experience under his sleeve, Dr. Ayodeji Ogunbemi, taking us step-by-step through sessions on the respiratory and digestive systems. Thank you for your commitment to the health and well-being of all, Dr. Sir.
Thank you very much.
All right, we're expectant of all we're going to, glean from you on the broadcast. We gave our word that the circulatory system will be our next focus, and we're making good that promise today. If you do not take notes now, I will assume it is because you know that you can revisit the broadcast on Western Spring Television's YouTube channel and our other social media platforms. The circulatory system and organ. Over to you, Dr.
Well, thank you so much for having me. And I must sincerely appreciate the management and the crew. I had the privilege of seeing so much that goes on.
Well, they appreciate you.
Thank you so much. Well, so I should go on.
Yes.
Okay.
Have the floor.
Thank you so much for this opportunity. The circulatory system. How should I start now? We can also call it the cardiovascular system. So circulatory means that something is going in circles, circulatory. Then cardiovascular, which is more anatomical. That is cardio, the heart. Then vascular, the vessels. So for people that are listening, to be able to understand, so when you say cardio, anything, anywhere you read it or you hear it, cardio means heart, then vascular. So I'll try within the little time, because this is an area that people will specialize in. And any specialist in cardiovascular system will be called the cardiologist. So I doff my hat to all cardiologists watching. Okay, let's go on. So the cardiovascular system or the circulatory system is a very intricate part. It apparently looks like the central part to all systems. Well, maybe I shouldn't put it like that, but without it, without any system, you won't have the whole body. But the cardiovascular system is such a unique one, intricately meshed together with other systems. So let me just break it down so that our viewers will understand very well. I've tried to divide it into 3 or 4 parts. The first part is that, let me list the components. We have the heart, we have the vessels, and the vessels could be, we have the artery and the veins, then we have the capillaries. Now it looks like this, it's just like a complete circuit. We have the heart in the middle, we have the artery taking the blood away from the heart to other parts of the body. Then we have the veins taking the blood back to the heart from other parts of the body. Then the capillaries appear to be like the intermediary between the arteries and the veins. So the heart is the pumping part. That's why when you feel the left side of your chest, you would, we call it, you palpate, you will feel the beat, your heartbeat. So it's a muscular organ. It keeps pumping, and it's a very strong organ. Very, very strong. So then through the arteries, we have the large arteries, the aorta, from the aorta, the big arteries, which are usually described as the elastic arteries. You would wonder why.
Yeah.
We call it elastic arteries because once the heart pumps blood, they must be able to receive it. And so they will expand to accommodate the blood coming from the heart, because the heart is pumping it with a whole lot of force. And then they accommodate it, they kind of reduce the tempo in which it's coming, then transmit it to smaller arteries, which are usually described as muscular arteries. Then from there, they now get to the arterioles. The arterioles are just very tiny, tiny arteries. Then from the arterioles, it gets to the capillaries. Then from the capillaries, from the artery side, then it gets to the capillaries on the venous side, that is vein side. Then it climbs up like that. Then through the inferior and superior vena cava, they enter the right side of the heart. So that's a way in which I can break it down. The second way I can break it down is to make us understand that there's an intricate meshing between the circulatory system, that is cardiovascular system, and the pulmonary system, which we discussed the last time. Because the respiratory system helps us to bring in the air, that is the oxygen. And one of the major goals of the circulatory system is to carry that oxygen gotten from the lungs, the respiratory system, to other parts of the body. Because other parts of the body need the oxygen. So how does this happen? I'm trying to break it down for people to get it. Okay, you may have to follow me stepwisely. Now, the heart, the human heart, has two sides. It has 4 chambers, but 2 sides. So it has 2 aortas, two atrium, and then 2 ventricles. 2
sides, could we say left and right?
Yes. So yes, we have the left side and we have the right side. So on the left side, okay, this is my left. On the left side, we have the left atrium, left ventricle. On the right side, we have the right atrium, the right ventricle. And you must understand, or people must know now, that the left side is the stronger side. I'll explain. The right side, the atrium from both sides, receives blood into the heart. So the right side will get oxygenated blood from the lungs. That is, the blood that passes through the lungs that have now gotten oxygen from the respiratory system and excreted or exchanged it for CO2. CO2 has, the respiratory system has taken the carbon dioxide away and given the blood oxygen. That is the blood that leaves the lungs through the pulmonary vein, leaves the lungs and enters the left ventricle. So let me say something like a low pressure is it, because the blood is just flowing into the left atrium. From the left atrium, the heart pushes the blood into the left ventricle. And then from the left ventricle, which is a very thick side, a stronger side than the right side, it forces blood, that it pushes blood from that side to other parts of the body. So the force there will be stronger than the left, which is only taking blood to the lungs.
And the right.
Okay, than the right. You seem to have got it. So the left side is more muscular, is thicker, is stronger than the right, because the right only receives blood. The blood the right receives is from the veins, and it's not under pressure. The veins are not really under pressure. The arteries are under pressure. The arteries are the muscular ones. So the left side has to push blood, and the blood must go round. So by the time the blood is returning, obviously the pressure is no more there. So the pressure, they are just flowing as you are walking, as you are exercising. It's aiding the venous return. Then the blood just returns into the right atrium from the inferior vena cava and superior vena cava. Superior vena cava, it drains blood from the brain, from the head, and then the 2 arms. The inferior vena cava from the lower limbs, that is the 2 legs, abdomen, and all the legs. So it gets into the right atrium. From the right atrium, gets into the right ventricle. From the right ventricle, the blood getting to the right ventricle is deoxygenated. That is, the blood getting away from the left is oxygenated. Don't forget I said from the lungs. They've gotten oxygen from the lungs. So it gets to the left side. The left side pushes oxygenated blood. That's why if you look at different anatomical descriptions, they'll put it like red, like bright red. That is, oxygen is more. However, well, I'll come back to that. So by the time it's getting back to the right side, different cells, different organs have gotten the oxygen. We've gotten the oxygen. So we have deoxygenated blood getting to the right side. So the right ventricle pushes the deoxygenated back to the respiratory system, right, to the lungs, so that the CO2, which is now bringing, collected, it gave oxygen, it received CO2. The CO2 now gets to the lungs, releases the CO2 to the lungs, then we breathe it out, then collects the oxygen, and then that comes back to the left side of the heart. So we can see that it's like a husband and a wife. The cardiovascular system or the circulatory system cannot exist without the respiratory system. They are just together. So that's analysis. So we call it, we can divide this into, they say, pulmonary circulation and then systemic circulation. Pulmonary circulation, that is, the circulation that goes to the lungs. If you look at it, it looks like a loop. And then there's another big loop below. So the other one that feeds the entire body is the systemic circulation. So that's another description. I think with that, I've already talked about the two sides of the heart. Then maybe I now talk about the functions of the heart. I was going to say earlier that by anatomical descriptions in many texts, you find the left side or the oxygenated side being so bright red. That's where it's painted. The artery is always painted red. Then the veins are usually painted blue. Then the layman would think the vessels and the blood, maybe the oxygenated blood will be blue and then the oxygenated blood will be red. Really, blood is always red. It's always red. However, once oxygen is taken away from the blood, it gives a bluish hue to it. So it looks a little bit darker, because during surgeries, there are ways to identify the artery from the vein. I mentioned one earlier. The arteries are almost always under pressure because from the left side of the heart, it's pumping seriously, you know, it's pumping with full force. So you almost always find the artery pulsating, you know. You almost always find the veins not pulsating, except the vein is lying over an artery. So it will just be moving at the pace of the artery. So you can identify that. Then the coloration. Oxygenated blood is usually bright red. Deoxygenated blood is usually like dark red. If you are checking it, maybe through a fair complexion person, may appear like blue. Well, it's not blue. It's just because the color has been filtered through the complexion of the skin, really. So it's more like dark red, bright red. You know, sometimes we ask people, if somebody says that he's pooing blood, we usually will ask, what's the color? Because the color will give us a description of where, and maybe it's an artery or a vein, and then maybe it's upper GI or lower GI. That's a big matter on its own. Then let's move on. So the artery. I've mentioned that we have different types of arteries. Then it goes on to the capillaries, from the capillaries to the veins to the heart. So if there's any problem along this number of vessels, and I need to let you know at this point that the heart is a very fantastic muscular organ. Do you know that at rest, the heart pumps about 5 to 6 liters of blood per minute, not per hour?
5 to 6
liters.
And this is inside our body?
Yes. Per minute, not per hour. And for an athlete, it can pump up to like 30 to 35 liters per minute.
From 5 to 6, then 30 to 35.
Yeah, because the more you, now this is it. As we are seated here, I'm calm, you are relaxed. The basic metabolism going on in our body is at a lower state. If you are sleeping, it's lower. My muscles are not really moving except for my hands. So the consumption of oxygen, the demand for oxygen, it's lower. But if I'm exercising myself, the cells in my body are demanding more oxygen, because oxygen is the source of, is the main thing. You get it? Is the fuel, is the gasoline, is the petrol, is what else you call it?
Human body.
Yes, of the human body. So the more I exercise, the more my cells start to demand oxygen. And then the heart has to supply the oxygen at the same rate. Else, this is where the issue comes in. Else, once there's no enough oxygen, the cells of the body try to get fuel from other things. Just like this is an international TV, but let's come to Nigeria. Let's come to Southwest. If there's petrol scarcity, people start to burn wood. Abi? They go to coal, which has smoke, Abi, and chokes people. Am I correct? So when you don't have enough oxygen in the body, the cells change from the oxygen. They try to look for other ways of getting energy. So they now have to go through fat metabolism and all the likes. And then that produces lactic acid. It's an acid which causes pain in that part of the body. So when people exercise to a point, one of the reasons why they will get to that signifies their limit is that they start to feel pain in their muscles. That place is aching me. It's because the supply of oxygen to that place is not being met. So there's another means in which the muscles are now getting the energy that is now producing lactic acid. So let me not bore you with that, because
it's interesting.
It's interesting. So that's that. Now, circulatory system does not only function around oxygen. I must say that at this point. Number one, oxygen. It has to supply oxygen to other parts of the body. And this is important when it gets to the brain, because the brain cannot do without oxygen for more than 4 to 5 minutes. You must understand that. That's why people that have stroke, intervention must be almost as fast as possible, within minutes. If oxygen is not getting to the nerves, particularly to the brain, 4 to 5 minutes, the nerves will just start to pack up. That's one. Then two, so the brain is also intricately dependent on the cardiovascular system. Number two is our kidneys. Do you know that the kidneys receive about 20% of the cardiac output? That is, whatever amount of blood comes out from the heart, 20% goes to our kidneys. So you can start to see that the kidneys, the functions of the kidney, by the time we get to excretory system, we talk about kidney and everything, is also intricately dependent on the circulatory system. So the excretory system, in which the kidney is part of, is also dependent on the circulatory system. The nervous system, which the brain is the coordinating organ, is dependent on the cardiovascular system.
Yes.
Can I progress?
Please do.
Now, when we eat, because I've talked about oxygen now, I've talked about CO2. Oxygen, circulatory system helps us to distribute the oxygen across the cells in the body, then collects CO2, carbon dioxide, from all the cells and gets to the lungs. So those two appear to be prominent, but that's not the only thing that the cardiovascular system does. Cardiovascular system also helps to supply all the cells with appropriate nutrients. So that gets us to the digestive system. That's why I said the circulatory system appears to be like the central system in which other systems are dependent upon. So if you eat, the only way the food, aside the digestion, the assimilation, the absorption, it is the blood that will carry the nutrients from your GIT, that is gastrointestinal system, to other parts of the body. Because when I eat now, it goes through my stomach, intestine, out. So what is needed in the food is absorbed by the blood and then distributed across other cells. Number next, so that's third point, that is distribution of nutrients. Number next is hormones. It helps to transport hormones. Hormones are chemicals released from different parts of the body that have other functions in other parts of the body. So there's no other way for these hormones to be transported to other parts of the body except that through the circulatory system. So the organs producing the hormones will release the hormones into the circulatory system, and then the circulatory system will now transport it to the organ in which it is needed. So those are 4 basic functions. Number next about the functions of the cardiovascular system is that all these I've described is like in a loop, Abi, like heart, vessels, back to heart, vessel, back to heart. If there's any leakage, now I use the word leakage so that we can understand. An average human being, an average adult should have like 5 liters of blood, 5 to 5.5 liters of blood. If there's any leakage, which occurs maybe in trauma, we call it hemorrhage, that blood is now coming out. If that leakage is not stopped on time, the person dies. We all know that. Somebody is bleeding. That's why anytime, either internally or externally, that's why anytime anybody is bleeding, people shout, let's help him. Because we know that as long as the blood is coming out, the blood will not be sufficient to go round. Abi? So the blood in itself, which is a component of the circulatory system or cardiovascular system, helps in clotting. Clotting is a process where, how should I describe it? Where we seal off the leakage, where the system itself seals off leakages, because you can also seal off leakages from outside. You know, we can say compress, you can surgically stop it, you can apply things to stop it. But the way, that's why if there's a cut, you notice that after a while, you have clot formation to stop the leakages. If not, to every cut we have, that's potential death. And I need to say this to potentiate the issue of leakages, that is hemorrhage. If, you know, that maybe you need to observe that whenever somebody is bleeding, after a short time, he starts to feel dizzy. It's okay, I can't, because blood supply to the brain is reducing, blood supply to other organs is reducing, and then the person starts to lose grasp of reality. And the person falls to the ground. And that's why we say, do you want to round up now? Or?
We won't round up. We'll just, hold it there for a while. We need to go on this very quick breather. And then when we get back, we'll continue from that part about, oxygen supply in the body getting less or when you're bleeding. Just quick breather and we'll be back.
Born Jeremiah Oyeni Obafemi on March 6, 1909, Obafemi Awolowo was a prime architect of Nigeria's independence and most consummate advocate of free education and social welfare in Africa's most populous nation. Erudite politician, thinker and philosopher, Awo was fondly addressed by associates and political colleagues, brought his unique attributes to bear on governance in the defunct Western region. He administered as leader of government business and the premier between 1955 and 1958. Obafemi Awolowo's premiership witnessed pioneering in multi-sectoral policy initiatives and execution. The Western region under his administration paraded several enviable records. First television station in Africa, first real estate in Nigeria, first high-rise building in Nigeria, first modern sports stadium in Nigeria, first agricultural settlement in Nigeria, first modern civil service secretariat in Nigeria, and first industrial estate in Nigeria. His face is on 100 naira denomination as a mark of honor for his distinguished services to his country. Western Spring Television identifies Obafemi Awolowo as a major character in history.
Up to 75% of human infectious diseases originates in animals. And as more bushmeat is brought into our cities, the risk of human infectious disease outbreaks increases. Ebola, monkeypox, Lassa fever, yellow fever, and even COVID-19 may have been transmitted in this way. Illegal bushmeat trade not only endangers our wildlife, but affects our health and may damage our economy. So please, say no to illegal bushmeat. Keep them wild and keep us safe.
Badamasi Adegoke Adelabu was a prominent figure in Ibadan politics and Western region before Nigeria's independence. He was a key founder of the National Council of Nigeria and the Cameroons, a political party that held lofty the torch of liberty for the two West African countries. He carved a niche for himself as a wordsmith and a creative speaker. The nickname Benkelemens was a natively corrupted version of peculiar mess, his bombastic English language style often used to score proceedings at the parliament. The author of Africa in Evolution, a handbook of freedom for Nigerian nationalists, was Nigeria's Federal Minister of Natural Resources and Social Services between 1955 and 1956. He died in an auto crash on the 25th March 1958 at the age of 42. Western Spring Television identifies Adegoke Adelabu as a watershed character in history.
Well, thank you very much for keeping faith with us on Spring Clinic on Western Spring Television. And today we're talking about the circulatory system, otherwise known as the cardiovascular system. Well, today I've learned a lot. I've learned that my heart has two sides, the left and the right. And before we went on that break, we were talking about the fact that, when you're bleeding, you could, the body begins to, sometimes the body seals the blood from inside or from outside. That's with help though. Doctor, over to you.
Okay, thank you so much.
But I did the job well. The lecture.
Yes, the summary was good enough.
Thank you.
Okay, we were talking about the sealing.
Yes.
That is when there's a leakage. I'm deliberately using those terminologies for everybody to be able to get it. So, but we'll likely, in medical terms, we say hemorrhage. That is bleeding. The person is bleeding. So, and I mentioned before we went on break that because the circulatory system or the cardiovascular system is central to other systems, when it gets to the brain, whenever there is bleeding, there will be insufficiency in the amount of blood that goes around. So the oxygen will drop. So the brain will not be able to take it very well. So the person has to feel dizzy, then later may lose balance, and then people say he fainted or passed out. Yes, it's correct, because the brain that seems to coordinate nervous activities will not have enough energy, source of energy, which is oxygen, to work. So it starts to shut down. So what happens? Because let me just deviate a little. When somebody has a form of bleeding, the first thing is that ultimately you must get the person to the hospital as fast as possible, because you really cannot see how bad it will be. However, on your way to the hospital, there are things to do, because we've seen quite a lot at the hospital. There are some practices that are wrong, though they have a good intent, but they are wrong. Number one is that at the site or at the scene, the person fainted, fell to the ground, or was feeling dizzy, and says, "Okay, I want to lie down." And if you ask them, they'll tell you that upon lying down, they felt better if they had not fainted outrightly. Why? Because when standing up, it requires some measure of pressure to get blood to the brain, because this is the upper part. So it's like pushing blood against gravity to get to the brain. So if the person lies down, the effect of gravity is reduced, so whatever amount of blood remains, it gets to the brain. So in fact, there are some procedures in medical practice that will tell the person to have the head down. You get it? That is to allow
Like
blood to get to
the lower
brain.
part of your body more elevated.
Oh, yes, elevated, because those are the limbs. And other parts, every part is important, but when it gets to the brain, cannot tolerate not having oxygen for like 5 minutes. The limbs can tolerate up to an hour. You get it? So don't try to lift up the head of the person. No, people do it. Okay, he has fainted. They now ask the person to sit down. They are opening the mouth. They are doing no. They are causing more damage. Just allow the person to lie on the left side. We mentioned it at one time, some time ago, on the left side, so that the blood, the little blood that is there can get to the brain. That's one. Number two is that people do a lot about tying. Maybe the hand is bleeding, or the arm, or the lower limb. Maybe people tie it. Tie it with clothes. Tie it with whatever, with belts. Yes, it's not bad in itself, but the moment you tie, you must start to count. You must start to time it, because there's a maximum number of minutes in which, if blood does not get to a part, particularly the upper limb or lower limb, that place is dead. You know, so sometimes people have good intent but bad practice. So the person gets to the hospital and is like, when did you tie this? By the time they mention the time, tell them, you can't untie it, we have to amputate the limb. Because, okay, that's another big thing on its own. Okay, hope I've not changed your mood, I'm sorry.
There was this time, before you continue, Doctor, there was this time, you know, I was stung rather by scorpion. I tied it.
Yes.
Was that wrong? Because the doctor's reaction was...
Yes. Now, let me keep this in. When it concerns health, I think the deeper training is for the doctors. Everybody should be interested in some basic knowledge about, in fact, even CPR, cardiopulmonary resuscitation. Everyone should be able to do a CPR, an effective CPR, not just CPR, an effective CPR. It's not that a doctor or a nurse or paramedic are the ones that should do it, because I see cases and people are like, doctor, what are you looking at? This person is dying. A husband should be able to do CPR on the wife. The wife should be able to do CPR on the husband. The husband should be able, the father should be able to do it on the child. We are going to get to cardiac arrest and things like that. You know, because so when it comes to matters like this, people should know. This should be common knowledge that you don't know. Now, if it's a scorpion bite, the native intelligence that people have is that you don't want the venom to move up.
Yes.
Is that not? To get to the heart or to circulate. So, well, in some instances, maybe snake bite, it may apply. But a scorpion does not, a scorpion gets to the muzzle. That's why the pain of a scorpion is localized. If you indeed saw the scorpion, the pain is at the site of the sting. And it's so excruciating. You know, that's one of the characters you used to know that it's a scorpion, because the sting, the venom doesn't go around. It's just to the muscles and it causes excruciating pain. In fact, you don't use normal analgesics, you use anesthetic agents to numb that pain. So you really shouldn't have tied it. Now you know.
I know now.
So people shouldn't, well, you can try to tie, but once you tie, in fact, the safe thing I want to say here, because medicine, it's so dynamic, and individuals are also dynamic. I can't compare myself with yourself. So if you tie anywhere, though it can still extend more than that, within 20 minutes get to the hospital. And you must let the health personnel know the time in which it was tied, so that we can calculate from that point. Obviously, by the time the person gets to the hospital, we know we have some leverages on some other procedures. Now, if the person is bleeding externally from the limbs, you elevate the limb. You elevate it, because once you elevate it, the force in which blood is going to gush out will be reduced, because gravity will be working for us, for the person to live. You know, then compress. Don't compress your hands except you have gloves. You can get gloves. That's why these things should be in everybody's vehicle. You should have a first aid have some things there. So just compress, at least put some pressure. It's a very simple thing. Once you put the pressure, the arteries will be compressed and blood will not be able to, filter away or get out of the system. Now, number next I need to say is that when people have some form of accident and they're admitted in the hospital and they're apparently okay, those that are bleeding, it looks like they're not apparently okay. I mean, it's obvious. So everybody's running up and down. But a trained personnel knows that the person that looks apparently okay may have some form of internal bleeding, which we call concealed hemorrhage. That is, the person is bleeding, but it's concealed because it's not external. That, when we tell people you can't go home until after 24 hours, you can't go after 48 hours, people like, I can walk, there's no problem with me. See my doctor, see my no, I can't stay. And tell the person, after counseling, after educating the person, we implore the person, the person is still like, no. Well, hospital is not prison, but I can't discharge you. Then people have to sign discharge against medical advice certificate. And then that shows that you are the one that left. But it is not a good thing. Because when people stay, and then when they are apparently well, you tell them to do some investigations and they're like, doctor, there's nothing wrong with me. In fact, it is that person you should help us look after. And we say things like, do an x-ray, do an ultrasound. Can you please lie down, let us examine your abdomen. It's like, what is the doctor looking for? We are trying to assess, is there a concealed hemorrhage? Because once it is concealed, you need an expert to know, and sometimes investigations are needed. So that we need to stop that bleeding as soon as possible. And there's something about the circulatory system. If it bleeds beyond the point, it becomes irreversible. Becomes irreversible. So before it crosses the irreversible border, that is, whatever you do after that time, the person will still die. You need urgent intervention. So when people are involved in an accident, and when accidents happen, people don't know the mechanism of injury. Sometimes people will not feel it because they have some adrenaline. There's an adrenaline gush whenever there's an accident. The person feels energized. But something may be going on with the spleen. Something may be going on with the liver. And those are the two major culprits with concealed hemorrhage. And the person can bleed to death. So you find such cases, the person says he had an accident yesterday, went home, there was no problem. Then by tomorrow, it's gone. So that's on hemorrhage.
You talked about border,
the boundary,
irreversible, points. Can we know the pointers?
Well, for the layman on the street, you may not know that. As I tell people, once there's a hemorrhage, get to the hospital on time. Let me quickly chip this in, because maybe this will help the doctors too, and then the patients too. Sometimes there's a procedure that needs to be done surgically. I will tell the person, get blood ready. The person is like, it's not just that they should just cut it. And now I tell them, the getting blood ready is that if it is needed, there are some procedures that it will be needed. There are some procedures that it will be given even before you start the procedure. There are some procedures that it is if, but so as not to delay and get to the point of irreversibility. This blood, we call it save and keep. Just let's have it there. Because sometimes people leave the option and say, but I donated 1 or 2 pints now. They didn't use it for my patient. They didn't use it for my patient. It's not that the hospital is trying to gather blood. It was that in case there's a need for transfusion, we cannot be looking for blood at that time. Let the blood be ready. So maybe I quickly run through some disease conditions associated with cardiovascular system. And a very common one is hypertension. Hypertension is very common. In fact, it's associated with aging, because increasing age and things like that. Hypertension simply means increased blood pressure. That's a very common sign of hypertension. Hypertension is a silent killer. That is, it doesn't give any notice until the problem has occurred. So that's why we say people should go for routine checkups. And it's very important. Number 2 that I need to talk about is that you must have heard things about heart attack. And we see it in movies now. Sometimes I laugh because these directors didn't consult the doctor before.
Well, is that exaggerated?
No, it's not. Now, what is heart attack? Let us not forget that the heart itself is a muscular organ, and it's also an organ that needs blood. It is the one pumping blood to every other place. But it needs blood. So the heart has its own blood vessel. Just like other organs have their blood vessel.
So it doesn't push out all of the blood, it retains some.
It pushes out, but part of those going out now coming through other branches, coronary artery, to enter the artery and to feed it. Now, for whatever reason, maybe there's a plaque, or there's an obstruction, or there's a thrombus that gets dislodged and blocks the vessel or any part of the vessel feeding the heart. That part of the heart that the blood feeds won't get blood. That part starts to die. Now, the heart attack is the last phase where we call, actually the heart attack is a street language. In medical language, we call it myocardial infarction. That is, a large chunk of the heart is dead. So once it is dead, it will not respond to contraction. When other parts of the heart are contracting, the dead parts will expand. So the blood will not go out. Now, but it's the spectrum, coronary artery disease. And the first phase is that patients have to have angina. That's what we call chest pain. Just like chest pain, you know. So, but we tell people once you have chest pain, there are a lot of things that can be occurring at that time. Some people will say it is a gastric acid disease. No problem. But you need to come to the hospital and we'll check. Is it the heart or is it the esophagus and the stomach? But there are some common signs. Number one, once there's the pain, it's on the left side of the heart. It radiates to the left side of the neck, to the left side of the arm, sometimes both arms, and then underneath. So if the pain is like that, it's most likely from the heart. The person should come to the hospital. Something must be done. Because the last phase is the heart attack. And it's actually with pain. It's different from cardiac arrest. Cardiac arrest is another thing. Cardiac arrest is, okay, I need to say this. You should have, well, I was going to say that somebody will be asking, what's making the heart pump? There's it's just like electricity, electrical impulses. These impulses can shut down for different reasons. Once they shut down, the heart will not pump. So usually we term that sudden cardiac arrest. Or if the impulses become irregular, because impulses are regular, that's why this one will contract, that one will dilate, this one will dilate, that one will contract. But if it becomes regular, nothing is going out effectively. And once blood is not getting to the brain and other vital organs, the person shuts down and die. This one that you're shaking your head. A very common one now is heart failure. Maybe heart failure, let's not look at the big grammar in defining it. Heart failure simply means the heart is failing. It's not pumping enough blood, sufficient enough for other parts of the body. So we say the heart is failing, and it's a process. And a very common symptom of heart failure, there are many causes of it. But the ultimate goal is that the heart is trying, you know, but it's not enough. Usually, this is how a very common symptom, we'll get there, we'll get to other ones, but the very common symptom is that the person, let's assume a person can walk 4 kilometers without resting. But if the heart starts to become insufficient, instead of 10 kilometers, now we'll have to walk 5 kilometers and have to rest. Because other parts of the body say, we are not getting enough blood, enough oxygen, so I beg, rest. And the heart is working so hard to keep pace, but no matter how it tries, it's not sufficient enough. That's heart failure. Now, when it becomes worsened, you know, so that even at rest, it is not sufficient enough. Usually it is when it is exercised. Then gradually, once it worsens, it gets to a time that at rest, the person is feeling tired, breathing heavily because it now has to get in more oxygen to compensate for the failure of the heart. You know, then when that starts to happen, now I said this is a closed circuit. Blood is leaving the lungs, coming to the heart. So if the blood in the heart is not being pumped enough, there will be some blood remaining in the heart, and then there will be a backlog in the lungs. So once there's a backlog in the lungs, the person starts to cough because the fluid remaining in the lungs, the person gets irritated, starts to cough. Then when the person wants to sleep at night, tells you, I need extra pillow. I can't sleep without pillows. So because the person has to be in how should I put it, heads up position, you know. But once he lies down, the fluid that is backed up in the lungs will not allow the person to breathe well. The person, you know. Now we have terminology for all this. But I deliberately decided to describe it. So when people are having such symptoms, they should get to the hospital on time. So we've identified one. Once they're having chest pain, come to the hospital on time. Once you notice that you are getting tired easily, you are not accomplishing the same work done with the same, just get to the hospital. Doctor, this one I can't sleep, lying down. Doctor, this one I'm just coughing. There could be other causes for the cough, but heart failure is also a cause of cough, you know. Pedal edema, once the heart is not pumping well, the blood will start to get congested in the lower part of the body. So that's why you see them, their limbs will get swollen. He said, once they lift up the limbs, after a while, it will become normalized. But once they drop the limbs, it becomes edematous, swollen, because the heart is not contracting well. Lastly, I don't know if I still have time.
Just a few minutes.
Maybe I should say this. There's a need for a regular assessment, regular medical assessment. All these that I've said, and many more disease conditions, do not speak up on time. We call them silent killers. So, but once you do a checkup regularly, the doctor and yourself get to know if there's a problem. And once identified early enough, the person has a long time for intervention. Most of these things are preventable. Thank you.
You said we need, in just a minute, we need medical checkup, regularly. But it is such that in our society, it is really expensive. I think that maybe some of the reasons, factors why people, do not readily make themselves available for this.
Well, I used to agree, but now I disagree. Now we have NHIS. Now we have OHIS, that is Osun State Health Insurance Scheme. So,
does it cover regular medical checks?
Yes, to a large extent. If not completely, to a large extent. Then number next is that you cannot compare the costs of prevention to the cost of curative medicine. How much a CT scan now, for those in Nigeria watching us, maybe it's like 40,000, 50,000, maybe more in some other places. So how much would echo be? Echo should be maybe one of the cardiovascular things we actually do, if there's a reason for it. How much is echo? But if there's a stroke, that is, in fact, I bet you have to do serious CT scans, or even MRI. MRI is far expensive than CT scan. That's just one test, though, when the stroke has happened. Not the assessment, not the assessment. I'm talking about curative. So we cannot.
Quickly, in few seconds, how often should a regular checkup be?
Yes, that's a very big question, you know, but we will usually say minimum of once a year. However, based on what we find, we will now determine the frequency with which you have it done. You know, if the person is okay, there's no problem, next year let's come. Then with increasing age, the frequency will have to increase, because increasing age is a risk factor for different other conditions.
Doctor, thank you. You will attest that I kept my part of the bargain, allowing Dr. Ogungbemi hold the longer part of the conversation. Well, for my reward, I request that you spread the word about Spring Clinic. Do the work of an evangelist. Let us get millions of views on all Western Spring Television's social media platforms. You don't have to be a doctor to be able to help others get well and live better. Prevention is in our hands, treatments in the medic's hands, and cure in the hands of the Almighty. Desirous of a healthy and wealthy world, it begins with you. I look forward to another highly insightful edition of Spring Clinic on your channel of choice, Western Spring Television. I am Temitope Ajijola Oluwala.